Good evening and welcome to our Facebook Live event focused on living well with kidney disease. This is the theme of World Kidney Day 2021, which is observed today on March 11th. For those who may not have heard of World Kidney Day, it is an annual global campaign to raise awareness of kidney disease and the importance of our kidneys. And it is a joint initiative of the International Society of Nephrology and the International Federation of Kidney Foundations. My name is Alex Radomski, and I am a clinical social worker at MedStar Georgetown Transplant Institute. I am joined this evening by my colleagues Jennifer Austin, a transplant nurse coordinator, and transplant nephrologist Dr. B.G. Thomas. This evening, we will be discussing ways to optimize your health, both while waiting for and after receiving a kidney transplant. We will discuss healthy habits to incorporate once you are on the transplant waitlist, and also talk about life after transplant, including how to care for your new kidney and how to live well with kidney disease. So Jennifer and Dr. Thomas, would both of you like to introduce yourselves further to our audience and explain about your role on the transplant team before we jump in?
Sure, Jennifer, go ahead.
Hello, I'm Jennifer Austin. I am one of the kidney transplant coordinators here at MedStar Georgetown. I am a pre-transplant coordinator for patients interested in a combined kidney pancreas transplant or those in need of a isolated pancreas transplant.
Dr. B.G. Thomas, I'm a transplant nephrologist here at Georgetown and involved with both pre and of course post-transplant, as well as general nephrology and including other organs that we transplant here, such as small bowel and liver transplants. If they have kidney issues, we also help take care of those patients.
That's really good to know. Thank you so much. We're lucky to have both of you here with us to discuss these important things, particularly on this World Kidney Day. We are also joined this evening by Sarah Ridenour, who is a social media specialist at MedStar Health. Hi, Sarah. Because this is a live and interactive event, we encourage those of you watching to enter your questions on the event page in the comments section. And Sarah will be monitoring those, and we will take the time at the end to answer those questions. So make sure that you're asking Dr. Thomas and Jennifer all about how to live well with kidney disease and about your general questions related to the kidneys. Okay.
Yes, please. We like interaction. We want it to be interactive. We don't want to lecture all of you. So as Alex said, please shoot out some questions and feel free. There's no bad question except the question that you don't ask. So please feel free to ask as much as you like.
I love that. Hopefully we get some good ones. So because it is World Kidney Day, Dr. Thomas, I was hoping you could just start us off by telling us some basic information about what our kidneys do for us and a little about kidney disease in general.
So the kidneys are some of the vital organs in our body. They are involved with keeping what we say homeostasis, involving with maintaining your electrolytes, the fluid balance, so you don't get too swollen up. Making sure that your body's blood pressure is okay, and many other things that they do. And unfortunately, chronic kidney disease is a major issue in the country throughout all types of races, both genders. All types of genders and everything. So it's important to realize that there are certain risk factors, and there are many things that you can do to take care of your kidneys. Some medicines, medications, or herbal supplements to avoid, for instance, making sure that if you have diabetes, that you take good care of your diabetes, making sure that if your blood pressure is out of control, that's monitored. So there's many things like that to do. So on World Kidney Day, the main idea is to make awareness of this, to understand the kidneys do exist, number one. There is staging for kidney disease. We'll get into that right now, but to understand that, we used to call it kidney failure if you had kidney disease, but that's not how it works. It progresses through different stages. And, the last stage is when people need some replacement therapy, and that could be a transplant, or it could be dialysis and those types of things. But the main thing to remember is there are many great websites too, is to remember that the kidneys are vital organs to us. They are very important to help us stay alive and have a very good quality and functional life. And that and understanding things like today are really important to help get the information out.
Yeah, that's great to know. I mean, it sounds like really anybody can be affected by kidney disease because of the risk factors that you mentioned. Is there any way to know how many people are affected by that in the United States?
There's about 2 to 3 people out of every 10, knowing or unknowing, are affected by kidney disease. That's one of the statistics that they show frequently. So if you look down the right or the left of you in an aisle, there's probably going to be 20 to 30% of people that are affected by kidney disease.
Okay, yeah, it's obviously a really prevalent thing, and it's something where we see a lot of people coming in for transplant evaluations, so that makes sense. So I think related to something that you said, one of the best treatments for kidney disease being transplant, I think one of the important things to address is how people can live well while they're waiting for transplant, because we also know it takes a long time generally to receive one of those. Jennifer, in your experience, are there ways that patients who are waiting for transplant can stay healthy? Are there things that they should look at in particular while they're waiting for transplant?
Well, I know at our clinic, while waiting for transplant, we ask certain things. We ask for patients to stay in contact with us so that we know about changes. Most often, a phone call will come in the middle of the night when no one is expecting it for a transplant. So it's very important that our patients keep in touch with us and keep us abreast of changes with their medical status or with their demographics, so that we know best how to get a hold of them when a kidney becomes available.
Yeah, that's an important thing. We obviously have to have all of the most recent information about our patients so that we can make the best decision for them. Anything people with some of those risk factors should pay particular attention to? Like if you're someone on the wait list who has diabetes or high blood pressure, are there things they can be doing to make sure that they're, maintaining in the right way?
Dr. Thomas, would you like to take this one?
So
blood pressure.
Go ahead. I'll chime in after you. Go ahead.
No, I think, following your doctor's orders. For people who are on dialysis, they're going to check your blood pressure before and after treatment. They're going to check your weight before and after treatment. And this is all so that you stay within the guidelines of the upper and lower limits of what your blood pressure should be running and what your weight should be running. And for diabetics, also for your sugars. And that's very important for preservation while on the wait list. And all of it helps us get a good outcome after transplant surgery so that we can have the best possible outcome for you.
Yeah, that makes a lot of sense. So staying well, kind of going into transplant on a really stable footing probably means better chance of success after transplant, huh?
Right, you want to optimize yourself prior to transplant. So
yeah.
For instance, if someone is out of rehab after hospitalization and they can't walk up a set of stairs, that patient you might want to say, hey, maybe right now is not the best time to transplant you. So if you're not on the transplant list, maybe come back in 2 or 3 months, get some physical rehab and et cetera, so you can go up a flight of stairs or 2 flights of stairs. So that's one example, and maybe a little bit extreme, but that just to put in everyone's head that, transplant is not a cure, it's a treatment, and it has its own side effects, its own complications. So you have to be best prepared when you go into the surgery. It's kind of like an athletic competition, right? You train for your competition or your event, and then you go on, right? So it's similar to that. That's what we tell the patients. And to add to Jennifer, you also have to listen to your dietitian and your nurses, particularly transplant, your pre-transplant nurses. So your pre-transplant nurses need some studies done, and they need some workup done, whatever it may be. It's really important to follow through with that, so you can get listed quickly, and things can go forward very quickly. And then there are many dietary regulations and those types of things, and that's really important to do. And I think the other part that is also, so we talk a lot about diet and but also don't forget your other issues, your medical issues that, diabetes and hypertension per se are the 2 most common causes of kidney disease. So making sure those things are controlled. And I think the other part that I would mention is also really important is, and I know you're gonna talk about this a little bit, Alex, is mental health. Is understanding that is not giving up hope because someone told you you have kidney disease, that there is still a full life to live.
Yeah, no, you're right. I think that's really important to drive home. And I would love to talk about that. Before we jump to that, I know we don't have a dietitian with us tonight, but can either of you speak a little further to the dietary considerations, or maybe just the exercise that might be good for a pre-transplant patient to pay attention to, just in general?
So for pre-transplant patients, there are certain, you usually, when your kidney function is 20% or so or less, you usually try to stay on a low potassium diet or a low phosphorus diet, so that those numbers don't go too high. That's typically what's higher. And then we tell them also there's a certain amount of protein that they can eat. We try to ask them to stay active if they can exercise, as much as they can, as much as they can tolerate. When you have bad kidney disease, the problem is, as much as all these restrictions, the other shoe is, or the side of the coin is, that they lose a lot of weight. The patients become lethargic, they don't want to eat. So you do want them to eat, it just has to be certain things you can't eat or skip out on, and because of the what happens to your electrolytes or such. Sometimes also your volume balance, if you're very close to dialysis, your team might tell you to do like a certain fluid restriction and items like that. There are a lot of good online locations. I think your doctors or your physician team will give it out to you, but the other place would be the National Kidney Foundation. They have a lot of great information at their website as well.
Yeah, absolutely. Okay. I know too, just in my experience, that when patients are getting on the transplant list, there are a lot of testing that we ask them to do that's really a part of their sort of regular health maintenance. Jennifer, what are some of the things that people sort of should be keeping up with anyway that are also good to have done for transplant evaluation, or that we ask them to do?
Thanks. So I was actually part of a clinic today. You can still see that I'm at work and I'm wearing my mask to keep safe in the pandemic. So what we ask of patients is we want to make sure that patients are safe going to surgery, which means that there won't be unexpected things happening during surgery or afterwards. So we ask for cardiac testing. And lots of times patients who have cardiac or who have kidney disease will end up with cardiac issues, just because the heart and the kidneys tend to work together. So I know we ask for, an echocardiogram and a stress test. And those are things usually for patients who are on dialysis, they end up having those types of tests. Usually their nephrologist orders them. Sometimes we will also ask for a CAT scan, or we will ask for sometimes if someone has fluid that we see on their chest x-ray, particularly if they're on dialysis, we may ask for some follow-up testing. And then also lots of labs. We want to make sure that, like Dr. Thomas was saying, that, with kidney disease, as it advances, electrolytes are off. And then, of course, the kidney function profile or panel is what we check for. And we just want to kind of keep an eye on things and see how things are progressing, because you want to make sure that someone is in the best shape they can be to be transplanted.
Yeah. And I want to go back to what Dr. Thomas had started to mention earlier, which was about the sort of psychosocial piece to this too. And I'm so glad he brought that up. It's interesting, at MedStar at Georgetown in particular, sort of the theme that we work by is called Cura Personalis, which means care of the whole person. And so when we're talking about physical health for transplant and for well-being, it's important not to forget the mental and behavioral health aspects of all of this. So part of my job is to talk about those things with patients and make sure that, from a mental and emotional standpoint, people are also living well. It's actually kind of stunning that the National Institutes of Health have found that depression is the most common mental health concern among people on dialysis, and somewhere like 23% of patients are considered depressed based on an interview diagnosis, and it's almost 40% for people who complete a rating scale or who go to a clinician and complete a rating scale. So it's pretty high in terms of people experiencing that when they have kidney disease. I would actually venture to guess too that it's higher now because we're all in the middle of a pandemic and we're all kind of stressed more. So paying a really close attention to that is an important piece of what we do. So what I would encourage people to do when they're trying to live well from that perspective is to really monitor their feelings and their mental health symptoms. If you're noticing a change in the way that you feel or your interest level, that you're talking to your transplant team, your social worker, your doctor, your coordinator, the supports that you have in your life, or the people at dialysis that are caring for you. And then consider some additional supports. That might mean a mental health clinician like a psychiatrist or a therapist, or it might mean coming to the transplant support group, which is something that we have every month, which is a really excellent way to support your mental health while you're dealing with this big thing, kidney disease and transplant. And I also kind of want to say that after transplant, it's not uncommon for people to still have these feelings. And I think during that time, people often feel like it's the wrong thing because they're supposed to be feeling happy and excited, and they are feeling that way, but they could also be feeling kind of overwhelmed and a little bit lonely because they're going through this new thing. So be aware that if that's something you experience, it's totally normal, but we want you to talk about it because we want to be able to help you feel good and live well from that perspective too. So before we keep moving on with this really good information, I would like to stop really briefly and just welcome anyone who's just tuning in. We're here on Facebook Live to talk about living well with kidney disease, which is the theme of World Kidney Day 2021, and that's today, March 11th. We've just heard from Jennifer Austin, our transplant nurse coordinator, about ways to optimize one's health while waiting for transplant. We've also heard from Dr. Thomas about those things and about sort of what to expect. And we've talked a little about the importance of mental health in addition to physical health. I'd like to ask you, Dr. Thomas, to talk a little bit more about living well after transplant. So could you speak a little bit to the period of time right after surgery while patients are still in the hospital?
Sure. And Sarah, let me know if there are any questions in the chat or in the on Facebook. So the transplant itself, so you get called in for a transplant, whether it be a living donor or deceased donor. You can get a kidney transplant, a simultaneous liver kidney, a simultaneous pancreas kidney transplant. So when you come in for the transplant, typically for just a kidney transplant, you'll come in on day, have the transplant on day, let's say the operation day was day 0. You get discharged usually by day 3. When you follow up in clinic, we follow you up very frequently, about twice a week for the first 3 or 4 weeks, and then weekly for some time. So, and of course there are lab draws, and we see you and we check you out, follow up your wound from the transplant and all those kinds of things. There are some patients that do still require dialysis after the transplant. About roughly 20 to 30% of patients still need some dialysis afterwards, and there are different reasons for this. But far and away, these kidneys work. As far as patients that, if the kidney does not work afterwards, that's very minuscule in that the number of times that happens. It's very, very low. So you get the transplant, you're doing well. If you're on dialysis, obviously we keep you on your dialysis diet, and you go the days that you go, and then as you make more urine, you come off dialysis, and you're what we call you resolve the delayed kidney function. And then as you get better, you can liberate your diet a little bit. You can start eating more potassium, or things with phosphorus in it, or whatever else that you're restricting. You can drink more water and more fluids, but you still have to have a heart healthy diet. You still want to make sure you eat right and those kinds of things. But also after 6 to 8 weeks or so, once you're up and going a little bit, try to get out, trying to walk, trying to have a little bit of exercise and getting your physical ability up. It does take time, particularly if you're depending on your age, and if you're an older patient, sometimes it takes several months really to get the benefit of not being so tired and things. So it's not a quick fix. There's a lot of investment by everybody, including the most important person, the patient and their family and their friends and their loved ones, into them. And after depending on how the patient does, they're back to doing what they want to do. So other than the immunosuppression they have to take, the pills they have to take, they have a kidney transplant that works. They don't have to go to dialysis. They don't have the symptoms of kidney disease. I think we were talking about it earlier, Alex, like many patients, the average weight gain is 10 to 20 pounds because they simply feel better. It's not because they did anything wrong. And that's okay. That's all right. And I would say that. So there are, of course, complications. So I'll mention that for you. So there are risks to transplant, and that's why I say it's a treatment, not a cure. So there is about a 10% or so risk of certain kinds of cancers like lymphoma. There is particularly for lighter skin, there is a significant risk of skin cancer, 30 to 40%, let's say, but it's not melanoma, which can kill you quickly. It's other ones that many times when patients go to the dermatologist, they see them and they burn them off. And, but the big thing is that I'm mentioning both these, so the patient is aware, and they also get a proper surveillance from a medical professional, right? And there's also, of course, in patients that are not diabetic, the medications have side effects. And there's all these effects are from the medicine, not the transplant per se, right? So there's maybe a 10 to 30% chance of risk of diabetes after the transplant. And of course, the risk of infection. But, there are people that transplant that work in the hospital. All these risks we say, so people are well informed, but they're not, those risks are far outweighed by the risk of significant kidney disease and being on dialysis. So if you were to say, well, I don't want to do a transplant because of these issues, those risks are smaller than if you don't get the transplant or if you stay on dialysis. But of course, not everybody's a transplant candidate, so it depends on the patient, and that's why they come to get evaluated and such. And again, post-transplant, the key is follow with us, and whoever your transplant physician is. Some of the patients do go back to their general nephrologist and their general team. And the other thing to mention, of course, is they should always maintain their, as we mentioned, their appropriate cancer screening. If they need a colonoscopy, a mammogram, whatever.
Okay. Yeah, so my kind of takeaway just from what you've said was that in a patient who is appropriate for transplant, the benefit, really outweighs the risk mostly, but that also there are a number of ways to kind of live well with kidney disease before transplant and after transplant. Like you can sort of maximize a lot of different things while you're waiting for transplant. But then, the ultimate, obviously, in living well is after receiving one.
Right. And, one of the things, for instance, is weight loss, right? We try to get patients down to a certain body mass index prior to transplant, to help out their heart and help their general living, quality and their health. And that should continue post-transplant, right? Right. Even though it's not necessarily the weight gain, but it's like activity level, we ask transplant patients, how active are you? What are you doing? It's summertime now. It's warm. Are you getting out of the house? Are you walking? And those are things that we want patients to do. Understand it's a pandemic, so right now it's a little bit limited. But even many of our patients at home have exercise equipment at home, or if they can't, they at least walk around on the floor. They do laps and stuff, and we encourage these things.
Yeah. What about, this is a question I get a lot from patients. What about things like alcohol intake or smoking? Obviously, we hear a lot about, the risks of both of those things, but what would you say in relation to transplant for either of those?
So I can ask Jennifer. Jennifer, what do you counsel them on pre-transplant? Post-transplant, we don't want them smoking. They are allowed to drink with control, of course, in moderation. We don't want them to get too intoxicated they forget their medication, or that they, of course, get volume depleted or dehydrated or have liver issues. But yes, you can. I always remember one of my patients. She was about 76 years old, and she wanted a margarita with her grandkids on her birthday. So okay, go for it. So there's plenty of stories like that. But yeah, so in moderation, it's okay. Jennifer, is there anything that you counsel them on the pre-side you want to add in?
What we tell patients and what we have found from the literature is that patients who smoke are about 8 times more likely to lose their kidney prematurely than those who do not. So smoking is definitely something we really discourage, and we really want patients to stop. I think everyone knows that their overall health is benefited from stopping smoking, but especially after transplant.
Yeah, I think it's really a good message to make people aware of what the benefits are to stopping smoking. That's good to know. Sarah, do you happen to know if there are any questions in the comments right now?
Yeah, we've gotten a couple. One I'll ask, right now, because it's related to what we're talking about like diet and stuff. Michael wants to know, is a plant-based diet or vegetarian diet best for pre or post-transplant?
So I guess for me, so a plant-based diet is fine. We have plenty of vegetarians and vegans that get transplanted. The main thing is to make sure that your protein intake is good. That you have a good amount of protein intake. That's the only thing that I think of. But again, we have a pre and we have a post-transplant nutritionist or dietitian that will go over that with you. But a plant-based diet is fine. And there are many stories where sometimes plant-based diets actually will help slow down the progression of kidney disease. I don't know if that's really played out, but the main thing is cholesterol and other things that hopefully come with that. The one thing to watch with plant-based diets though is watching your carbohydrate intake, because you can have a much larger carbohydrate intake with purely just plants. So if you're if you're eating rice all day or eating a lot of bread as your plant-based diet, then that can result in issues, right? So just want a well-balanced diet. Make sure your protein intake is good. And if you are, if you have the ability, if you are a kidney patient, you have access to a dietitian that you can talk to, and I would talk to them about anything that they recommend.
Right. And kind of on that same track, talking about diet, we have 2 other questions related to that. SJ asks, how important is it to monitor potassium levels in addition to other electrolyte levels?
So it's more for the healthcare provider. So pre-transplant, right? One of the indications if you constantly have high potassium and you need to be emergently dialyzed, that might potentially lead you to start dialysis sooner. But now we have medication that can help keep your potassium down that your nephrologist can give you, and that's by mouth, and that you can take every day to keep potassium down. So that's really not a reason to start long-term dialysis anymore. But it's very important to watch your potassium intake so you don't run into those issues. Post-transplant, if your kidney is working, and it's doing really well, we let our patients whose kidney function is very good, they pretty much are liberated to eat what they want to eat. We don't put them on a low potassium diet. Now, not everybody's kidney transplant comes back with the kidney function being, above 60%. So it depends where it lands. So if their kidney function is less than that, and we are concerned, or they have a tendency to have high potassium, then we tell them to have a low potassium diet. The other key thing to also understand is you're going to be on medication post-transplant that increase potassium. There's a group of drugs called the calcineurin inhibitors, tacrolimus and cyclosporin, that can increase your potassium. So that's another reason why it's not always the patient's fault. Sometimes it's the drug's fault. So remember, that would be something important to remember as well.
Yeah. And now this one's a little bit more of a specific question and specific to her situation. Daphne asks, is there anything in particular that I can eat or drink to keep my one kidney strong and healthy? She had a little bit of background. I, in 2007, gave my brother one of my kidneys, which pushed me automatically into HBP. She also has high cholesterol. And so she's just wondering if there's anything, specific that you can recommend for her.
So I don't know what HBP means. I don't know if it means high blood pressure or something else. But so when we tell our kidney so living a healthy diet, healthy lifestyle is what you should do. So it's not only what medication. So there are food you can eat as you like if your kidney function is good. Just again, heart healthy diet. But the other shoe is like we would like people to avoid non-steroidals, such as ibuprofen, right? And because that can also damage or hurt the kidneys. Of course, don't try to not smoke and try to live a healthy life. But and also herbs and supplements. Some are very good for you, but some can also damage the kidney. Jennifer, did you want to say anything on the pre-side when you hear this question?
No, I was just going to support everything that you had said.
Good answer, Dr. Thomas.
So, and the other thing that I really would want you also to say is drinking water. Everybody says drink a lot of water. You should drink as you feel thirsty, maybe a little more. Don't get volume depleted. But there's no study that says if you drink tons of water that your kidneys are going to do better. Yeah. Right. So if you're drinking water just purely because you want to drink water, not because you feel thirsty or not because you're dehydrated or anything like that, or then you not really going to help the kidney that much. Right. We want you to stay well hydrated, but it doesn't mean forcing yourself to try to down gallons and gallons of water every day.
That's good to know.
Yeah, thank you for that. Yeah, we have a couple more questions from the viewers that I can get into, unless Alex, you had anything else?
No, yeah, please do. I think this is the perfect time.
Great. Yeah. So first of all, thank you everybody for your questions. We really appreciate all of the questions and you guys joining us today. So first of all, we'll start with Glory. She asked two questions. First, she asked, how do you get kidney disease? I think I'm in stage 2, and what is the best way to prevent going into stage 3? And we also had another question from Dixie, who's in stage 3B of kidney disease, and she also wants to know what she can do to keep it from progressing.
So kidney disease, the risk factors typically, we mentioned one, so you can take medications such as ibuprofen over some time that potentially can cause damage. Sometimes herbs and supplements can cause damage to kidneys. Right now, with the country, a lot of with obesity being a major issue, that can cause kidney disease, by default, leading to diabetes, hypertension, and such. So a lot of these factors I'm mentioning are risk factors for anything in healthcare. There are diseases specific to the kidney. There's some what we call nephritic or nephrotic syndrome. certain diseases that go there in that group. There are kidney stones. There could be an allergic reaction to kidneys. I mean, not kidneys, sorry, allergic reaction to drugs that injure the kidneys, and things like that. So there's many potential issues. The thing that you can do is the same thing. Follow up with your physician or your advanced practice provider regularly and get appropriate medical care, appropriate medical screening. Make sure that you drink and eat a heart healthy diet, exercise, try to maintain a good weight. Those are the ways you can best do it. And you also have to know the genetics of your family. If everybody in your family has diabetes, if everybody in your family is obese, or everybody in your family has hypertension, everybody in your family has ended up on dialysis, these are things to think of, to really think of what were their risk factors to avoid them. We have patients that come that want to donate to their sibling or their father or mother, and then I ask them, how did your father or mother end up with kidney disease? And they will say to me, that my dad, he worked very hard, but he didn't really take care of his diet or himself. And now I'm much, for me, I'm working out 4 times a week, et cetera, et cetera. So these are important things to understand. As far as progression of disease, number one, definitely whoever is taking care of you, follow their advice. There are at stage 2, so to dive into the stages just a little bit, stage 1, it goes from stage 1, which is the earliest part of kidney disease, to stage 5, which is essentially you're going to be on dialysis, right? But the problem is the widespread. So the only time you really see a nephrologist actually is when your kidney function is around 60% or less. So that's roughly stage 3, but more, and more towards 3B. That you might see a kidney doctor. And that is just all the kidney doctor will do is really make sure your blood pressure is good and make sure all the other items are ticked off that we'll do to take care of you. But the main thing to prevent progression is whatever the cause of your kidney disease is, to treat that, number one. And to, again, I know I keep saying it, really living a healthy diet and healthy lifestyle, and avoiding anything that might be toxic to your kidneys. Those are the things I would say.
Great, thank you. And so, speaking of living a healthy diet, we have another diet question.
We should have a dietitian on today.
Yeah, we should.
SJ wants to know, how does one balance the requirements of a renal diet versus diabetic diet?
So that I would first of all talk to your professional dietitian that would take care of that. There are some things, so that they'll know the tricks of the way to do it. So the real thing with the kidney diet that you really want to do, it depends. What we're trying to avoid is, first of all, make sure that your disease doesn't progress very quickly. So, or that you need urgent dialysis. So on the kidney diet side, yes, we tell you typically a low potassium diet, low phosphorus, low salt, and those probably kind of go over into the diabetic diet as well. The diabetic diet is usually a little more liberated, right? In the things that you can eat, I think. But there are some things, for instance, you can't, if you have orange juice, has a lot of potassium in it. So you want to avoid that both in the diabetic diet and per se in the kidney diet. Instead, you could have apple juice or something like that. It's really hard. I would just find where both of the things match more, and I would work it that way. And remember, you have to live. You don't, even if you stay on the strictest diet, you have to live your life. So, if you're cutting all the things that you enjoy out of your life because of these diets, you can cheat a little bit here and there, but just know how to do that.
So also be monitoring like blood sugars and things like that. I imagine that's okay. Part of that.
Right. So particularly, there's for all the diabetics, you know your hemoglobin A1C is or whatever, and your blood sugars are. If they're very uncontrolled, then obviously you have to be tighter with something, right? If they're very, very well controlled, then you probably can be a little more liberated with what you do.
Okay.
Yeah. And so we have another question from SJ. At what point is a kidney function test recommended? Is it based on a certain GFR level and or creatine level?
So the kidney function we measure by something called the creatinine. So that's like that's what we check. That's a blood we get it from your blood. That is used to put into a calculation to figure out your GFR or your glomerular filtration rate. If you imagine it like this, the horsepower in your car is your your creatinine, and how fast you're driving is your GFR, your miles per hour in a sense, right? So they're related, but they are the same thing in a sense, but they're not the same thing, right? So when we do that classification of kidney disease, that's based on your GFR or the glomerular filtration rate. So if you're at stage 1, it's 90 or above. Stage 2 is 60 to 90, 3A is 45 to 60, 3B is 30 to 45, stage 4 is then 15 to 30, and stage 5 is near dialysis would be less than 15. Most people start, so when people get referred for transplant, your kidney function has to be a GFR, or to make it easier, that's why I say percentage to my patients that are not in medicine. So the GFR of 20 or a kidney function of 20% or less, you can be referred for a kidney. Typically people start dialysis when their kidney function is closer to 10% or that GFR of 10. So those are things. So when your GFR is close to 30, is when we 25 to 30, we start talking to patients about what kind, about kidney replacement therapy, about looking for a living donor, about access for dialysis potentially, and those kinds of things.
Can I ask a question based on that?
Sure.
Just listening to you talk about the stages of kidney disease, I was kind of thinking that possibly patients being aware of that, but also being aware of when to be referred to transplant might be one way to kind of manage living well with kidney disease, right? So we kind of want patients to come to us as soon as they're able to, right, to talk about transplant potentially.
Yep, I'll let Jennifer take that one.
I'm sorry, Alex, please repeat the question. Oh, the light just came back on.
Sure.
So can I rephrase it for you? So Jennifer,
please do.
One is when we know that, okay, so I already mentioned that you can list them. Patients when their GFR is less than 60 can ask to see a nephrologist. When it's about 20%, you can get listed for a kidney transplant, right? That's when you can. What I wanted to ask Jennifer was, in regards to pancreas, if somebody has diabetes, when should they start thinking about a pancreas transplant?
So I think that is very surgeon and doctor dependent. It depends on what camp you fall in. I know over here, we say that anyone who is type 1 diabetic should be referred for a pancreas transplant.
At least an evaluation, right?
Evaluation. Yes. And then also people who have kidney disease and are on dialysis or even preemptive, like what you were talking about, stage 4 with that GFR hit, around 45 or lower. You want to start seeing if maybe they have a history of type 2 diabetes. Lots of times patients will say, oh, I'm not on insulin, so I'm not diabetic anymore. And that's really kind of a misconception. We know, and I know that you know as well, Dr. Thomas, that when patients do get their transplanted kidney, often they will end up on insulin if they were not on insulin before, or if they were on insulin before, they'll end up back on insulin.
Right.
So we try to educate patients and let them know that just because you're not type 1, maybe you developed it when you were 40 years old or 50 years old, there still is a condition. So we refer patients for both a kidney and a pancreas if you're type 1 or type 2. But like I said, over here, anyone who is on insulin with type 1, we try to give them a transplant. And then even those who are not on insulin, but are on the waiting list for a transplant or being evaluated for a transplant, and they carry a diagnosis of diabetes, we're able to help them out with a combined kidney pancreas transplant as well. Because we list them for an isolated kidney, but we also list them for potentially for a combined kidney pancreas.
Yep, and some patients even do pancreas after the kidney transplant. So, but this is for diabetics. And the main thing I think the take-home point is, if you have diabetes, when you come for your evaluation, just ask, would I be considered to be a candidate?
Yes.
It might be no, but there's no harm in asking. And when should you get screened? Sorry, the initial. So your primary care doctor usually screens at least once a year, does all your lab work, and that's usually how it happens. Some patients do find out they have kidney disease because they did their life insurance test or something, or they don't even know they have kidney disease till they're right on the verge of dialysis.
Yeah.
So again, appropriate screening with your healthcare provider through the course of your life is important.
Yeah, I wanted to say something about that too, as you guys were talking. I really feel like I think there's I think the perception is that like kidneys are silent. When you start to go into kidney failure, you don't get like chest pain like you do with if you have a heart attack or something like that.
Yeah.
And I find that lots of kidney patients, they have to be proactive because they may just have that once a year screening or that 6-month screening. And if a doctor doesn't have any other number to compare it to when he's looking at your creatinine or GFR, he may not refer you. He may not do another test for another 6 months. So I don't think that there's anything wrong with being proactive in your own health when it comes to kidney disease, and trying to advocate for yourself and finding out, where exactly you stand if you do have a concern.
That's great advice. Yeah. So living well with kidney disease, even if you're not sure you have it, means knowing about your health and going for regular checks, being involved in your own care.
Yes. Yes.
Yeah. That's great to point out.
Yeah. I have a couple more questions.
Oh, good.
But this one we actually kind of talked about in the last Facebook Live the three of us did. And Ada asks, has the COVID-19 pandemic affected organ transplants at Georgetown?
Alex, what's your answer?
No.
Jennifer?
Fortunately.
No. COVID-19, so we are still very strict with the transplant. So we did we did 330 kidney transplants or so in the last year. So through COVID, we were still transplanting many patients. Our precautions are, just so that you know, the patient is dropped off at the curbside, and they come in, they start getting their testing. Let's say a patient gets called in, sorry, to get transplanted. They'll be dropped in at the curbside. They go to the emergency, usually through the ER, and they'll be tested for COVID, and then they have to be with a rapid test, and those tests are very quick now, so they have to be negative. The floor we go to for transplant is also COVID-free. There are no COVID patients on there, and it's a very restricted unit. No visitors presently are allowed to visit our transplant patients when they're in the hospital. So when they get discharged, it's like curbside pickup. It's kind of funny. We joke with the patients that it's like they're picking up come and pick me up and pick up some food. But we've been very successful so far. From what I know, at least, there has been no patients that we've transmitted COVID to on the like a fresh transplant has not had COVID. The other answer to that question is, so we were able to transplant. The other thing I would segue into is the vaccination. We do recommend for post-transplant patients to be vaccinated after a certain time. Check with your healthcare provider. Same thing with pre-transplant. Check with your provider, but we would, of course, recommend that you get vaccinated.
Great, thank you. Our next question is from Cindy, and she asked, what percentage of risk for cancer comes from the immunosuppressant medication? If you can give an answer to that.
What was it again?
What percentage of risk for cancer comes from the immunosuppressant medication?
So everybody has their own personal risk, so put that aside. Roughly, I would say it's a large ratio, but roughly for other than skin cancer, 5 to 15%. So, that includes lymphomas, colon cancer, breast cancer, these kinds of things. That's why we say it's very important to stay up with your screenings. Very important to keep up with the appointments so we can follow along. Somebody has strange symptoms, we don't know what's going on when we start to investigate. Skin cancer is much higher, roughly 30 to 40% of individuals, particularly lighter skin. That does not mean someone who's darker skin cannot get skin cancer. They certainly can. And again, melanoma, really bad skin cancer, is very rare. It's the most common one is what we call squamous cell, but basically that's, if you see the dermatologist regularly, they'll just burn it off. Now, let's say someone does have a cancer, or let's say someone has multiple skin cancers. The cancers usually are very treatable, and by doing what we do is we reduce your immunosuppression. So it's a balancing act to keep the organ as well as to reduce it enough so that you can fight off the cancer.
Right, thank you. Next is from Glory, and she asks, does taking blood pressure medication have any effect on your kidneys?
So hypertension or elevated blood pressure can damage your kidneys, can damage your heart, can damage your brain, can multiple things, but the things that we think of is what kills you, right? So stroke and heart attacks. And again, the kidneys are affected as well, whether hypertension be the primary cause or it could be from something else, right? So yes, so taking blood pressure meds and keeping your blood pressure controlled is an important way to prevent the progression of kidney disease.
Great. Our next question is from Maria. She says, is CMV common with transplant recipients? I'm not sure what CMV is, but.
So CMV, that's okay. CMV stands for cytomegalovirus. So majority of the population in the world have it. So let's call it back to CMV. So CMV is a virus we all get as kids, basically, and we all have it. The majority of us have it. So after transplant, what happens is you get put on medication to prevent it. for 3 months to 6 months, in some institutions up to a year. So, you know, the risk is definitely there. If you were to but usually when you're on the prophylaxis or we're watching you very closely, you know, maybe 10 to 20% of patients get the virus. You might not feel any symptoms. The viral load might come back positive. We check during the first year at Georgetown, we check twice a week for every 3 weeks, and then very regularly every 1 to 2 weeks to every month. So we'll catch it very quickly before symptoms hopefully appear. What symptoms might you have? Flu-like symptoms. Usually CMV, you feel like you have the flu. It can be really bad when someone gets a meningitis or a bad pneumonia, or your bowels can be affected. But usually it's more like viral-like infection, and we see it and we treat you for it. But yes, does happen post-transplant, but it's majority of the time it's very treatable, and patients do just fine.
And the risk of that, or the reason that is more common in post-transplant, is because of the immunosuppression, or is it something else? Okay.
Right, so it's primarily because we're suppressing your immune system, so these viruses, these bugs that are usually kept at bay can come out to play. Did you notice that rhymed?
Well done.
Our next question is from Edith, and she says, does drinking more water improve creatine levels?
So this is a double-edged question, right? So if you make something and it's too salty, right? What do? You add water, and now it's not as salty, right? The same thing with creatinine. If you drink tons and tons of water, you'll falsely bring the creatinine down. So we can dilute it, as we would say, right? So so if you're drinking a lot of water, you're not really trying to chase that creatinine. But I brought it down by whatever amount of points. Doesn't mean the kidney function changed. It means that they have a lot more water on board, so you diluted that number, right? So so there's no study that shows drinking a ton of water makes your kidneys per se function better. The real thing is just to stay well hydrated. You know, if you want to drink an extra couple glasses, that's fine. It doesn't mean you have to walk around all day with a jar of water and constantly be drinking. You know, that's what some people do, and that's fine. But it doesn't. But medically speaking, there's no data to say that significantly improves your kidney function. You know, the main thing is that if you're walking around if you're not drinking all day and you're thirsty and you're barely urinating, well, then that's a sign that you need to drink more, right? Then you need to put some water in. That will help you. But following purely the creatinine is not good. Obviously, if you don't drink enough, that creatinine will go up, telling me that you're volume depleted or dehydrated. One of the most common reasons when patients come to the emergency room from the outside, from a clinic or from home, many times the reason that they're coming in with their kidney injury is because they're volume depleted. They're having nausea, vomiting, GI problems, and they come in very dry.
Dr. Thomas, I think sometimes there's a misconception out there, or for patients specifically who also have polycystic kidney disease. I know I run into a lot of those. I think that nephrologists are telling them that they should drink between 3 and 4 liters of water a day.
Right. So there are some situations that you can. Okay. So if your healthcare provider tells you, then that's different. But there's a myth that, you know, if you drink more water, your kidney will be better. That's kind of what I'm trying to. You should drink water or whatever fluid of your choice, but you don't have to pound it where you're forcing yourself to the point of nausea that you're drinking water. Okay. But there are some cases where you do need to drink more water, and not only patients with polycystic kidney disease. Some people that are on certain drugs, they constantly spill water all day long. They have a certain kind of issue in the kidney from the drugs they take, and because of those medications, they have to keep up with their water. You know, so there are situations that are specific that people do it. So ask your healthcare provider how much water you think I should drink.
Okay.
Yeah, I wanted to bring that up just because we don't know what our viewers are afflicted with.
Right. So if your healthcare provider tells you something different, then I would go with what they say, because they know your situation the best.
Okay, but it sounds like it's more about keeping sort of a balance of certain things versus it affecting the kidney function. Is that right?
Right. So if you there's always this conception where if I just drink a big jar of water every hour, my kidneys will be better. That's not true.
Okay. It's interesting to know.
Yeah. We have a couple more questions. Kathy asked, once on dialysis, what can you do to prolong life as is or improve the quality of life?
I'm going to let Jennifer answer that one.
Once you're on dialysis, so I think that those persons who are just starting dialysis have the roughest time. I think the first year of dialysis, from what I hear from patients, they have the hardest time with side effects and things coming up and adjusting, but also medically, they find themselves in the ER more than they had before for, fluid retention or overload or things like that. But I will tell you that if your doctor has put you on dialysis, the best thing you can do is to go to dialysis, do it for as long as they have asked you to do it, for what they have prescribed, and follow what you are being asked to do. If you're asked to cut your sodium intake, then please do it and keep it within a certain range. Learn to read labels on foods. You turn a box of crackers over on the back and look at how much a serving is, and then look at the sodium in it, and that will help out when you're on dialysis. And the same goes for other electrolytes such as potassium. And then looking for, foods that are high in phosphorus. These things, and avoiding them. But these are things that will help out while you're on dialysis. I think the best thing that you can do is do what is asked of you. Your provider is looking to help you, not hurt you, and reach out to the resources that are at the dialysis center. Dialysis centers have dietitians, they have social workers, they have people that will help out with all aspects, and they will most often help you out with the transplant listing and getting evaluated if that is your desire. And I will defer to Dr. Thomas.
Well, I was going to say same thing, right? Exactly what Jennifer said. And then, of course, trying to see if you're able to be a transplant candidate is really important. The other thing is when people think of dialysis, there are mainly 3 different ways. One is the in-center hemodialysis. So you come to the dialysis unit 3 times a week. There is a home version of that dialysis, which is daily home hemodialysis. So you can, which is 5 to 6 days a week, but you do it at home. There are certain requirements to be able to do that. There's also peritoneal dialysis, which is through the belly. And again, certain requirements for that. So you do dialysis not only in the dialysis unit. There can be times, certain people that can do it at home. And I think that thing is referring for transplant is really important. And Alex, do you want to speak to it too? Because I'm sure you see all the other patients pre-transplant. Is there any advice that you give as well?
Yeah, thank you. Yeah, I would love to talk a little bit about the quality of life question. So one of the things I would encourage people to do is to surround yourself with a really strong support team, a support system. So that might be your family members, that might be friends, that might be people you go to church with or your neighbors, but make sure you have somebody you can talk to about all this stuff. Like Jennifer said, it's a very overwhelming time in a lot of people's lives when they're first starting dialysis or when they're learning to manage a chronic disease. They may have never done this before, and now they're having to do dialysis 3 times a week or do these home treatments. And it's a lot to kind of learn and navigate. So realize that's going to take time, but make sure you have people you can talk to about it or people you can ask for help with certain things. When you're going through this or going through transplant, it's a really good time to ask for help. A lot of people don't want to because they're independent and they're used to doing things themselves. But if you're going to ask for help at any time in your life, it might as well be this time, when you're feeling overwhelmed. And like Jennifer said, use your resources, talk to your social worker, think about coming to a support group, try to have a bit of a routine so that you don't feel as overwhelmed.
Great, thank you. So our last couple questions are all transplant related. So the first one is from SJ. And they ask, can a living donor ever have a kidney transplant in the event their one kidney starts to fail and then they end up needing a kidney?
So since we're running out of time, I'll answer it quick. So living donor, if someone donates a kidney, they have the privilege of going to near the top of the list if they need one. So if their kidney function drops to 20% and they come to see us or anybody and they say, oh, and we know that they were a living donor prior to that, they get priority. So they will be transplanted roughly within 3 to 6 months, regardless of blood type, regardless of anything. They get that priority. So they should be transplanted relatively quickly.
Okay. And then I probably should have led off with this one, but Consuelo wants to know if you can talk about the transplant process briefly.
Go ahead, Jennifer.
Okay, so a patient is referred. They're either referred by themselves or by their nephrologist, or in some cases by an endocrinologist, PCP, someone refers you. There's an intake coordinator who will call and ask questions. and then you will be scheduled for a visit. When you currently, because of the pandemic, we are doing all of our visits via Zoom, like I'm
this.
sure by this time all of us have participated in one Zoom call at least. And you will meet with the team. The team consists of a transplant coordinator nurse like myself, a nephrologist like Dr. Thomas, a social worker like Alex, and then a dietitian and a financial coordinator. So you will meet with the team. The appointments, you'll probably speak with each person, probably 20 to 30 minutes, depending on your history and concerns. And then what happens is we have a selection committee where the entire team meets of all the members. We're a pretty big group, and all the patients are presented. There's one of three outcomes. Accepted, which is what we look for everybody, which means that you're accepted to continue into the process of potentially being listed for a transplant. Denied, which usually is for pretty blatant things that are pretty easy to see. Or there may be a word like deferred or pending, which means that we need to check something out. This could be after you complete your routine testing for us or before. Each center is different. I know that I'm very familiar with doing, like I had previously stated, when we were talking about testing, we do cardiac testing. Sometimes we'll ask for a CAT scan of your abdomen and pelvis, depending on whether or not you have a history of heart disease or vascular problems, or if you have diabetes. And then we'll ask for things like a chest x-ray and blood. Transplant is pretty specific, like Dr. Thomas was talking about with the medications that we give you. So we often look at the antibodies on your blood cells. You guys are welcome to look this up and Google it, but we look at your immune cells, specifically B cells and T cells. And we kind of measure and count the antibodies. And that is helpful for us when finding an organ for you that will be a potentially good match. So if you are accepted and all the testing looks good, and we place you on the UNOS transplant list, which means that patients have the responsibility of, number one, getting their blood tested for that transplant lab every month. For patients who are on dialysis, they may choose to have it done at the dialysis center. However, it is the ultimate responsibility of the patient for it to be completed at the dialysis center. We at a transplant center cannot say to a dialysis center, you need to draw this blood for this patient and send it to us. So sometimes patients decide to take their kit to an outside lab, like LabCorp or Quest, and sometimes they choose to come here and have it completed. Either way they have it completed, it should be completed once a month. When there are changes, such as demographic changes or changes in their health status, or if they go into the hospital or if they have a procedure, they need to notify us. All patients are assigned a transplant coordinator nurse. So each of us as transplant coordinators kind of have a population of patients that we take care of. When you receive the call for a transplant, it most likely will be at odd hours. You'll be instructed what to do. There's an on-call coordinator that is a nurse like myself who will give you a call and say, hey, we have a potential match for you. And you have the option to say yes or no. At our center, we have a lot of options for different kinds of kidneys or different types of kidneys for our patients to choose from. This differs from each center to center. For example, at our center, we have living donors, which are potentially the best for patients. Some patients are not candidates for living donors. We also have, we offer patients hepatitis C positive kidneys because potentially now we can cure hepatitis C. And then also we have UNOS criteria of increased risk donors, which usually tend to turn out to be pretty good donors for our patients. So those are some of the advantages of receiving many calls if you opt to be allowed to be called for those types of offers. So you'll probably receive a couple phone calls after you receive an initial offer. You'll receive the first call and they'll say, okay, we'll call you back in a while after we know more about the donor. You may receive the second call and they'll tell you, now I don't want you to have anything else to eat or drink from this point on and wait for my call again. Lots of times we won't know anything until you come into the hospital. You may be asked to go home once you do get into the hospital because as good as our diagnostic testing is, there is nothing that replaces the surgeon looking at the organ with his own eyes and viewing it and deciding that it's a good organ or not. We certainly don't want to put, we don't want to put any of our patients at risk or have them have a potentially bad outcome or a limited outcome because of an organ. We always get the best for everyone that we have to offer. And afterwards, as Dr. Thomas had mentioned, you will come to clinic quite frequently, probably twice a week for a while. There will be frequent blood draws. We need to monitor the amount of medication that is in your body. He had mentioned drugs like tacrolimus and Cellcept or mycophenolate. Tacrolimus is usually measured with a level, kind of like antibiotics are. So it'll be important that we have an accurate level of that. And you'll be asked different things. And you'll follow up with our clinic. And then, as Dr. Thomas had said, you may eventually go back to your own nephrologist. But everything is very individual. Each patient is different. Everyone has their own story to tell. And transplant is very unique. Oh, how'd that go?
That was good.
Wonderful.
So I would just add, so the surgeon is, you potentially can see a surgeon. And then the other thing is when you should look for a living donor. That's really key. So when you're in the transplant process, and it's important to look for a living donor because if you're O blood type, your wait time could be up to 7 to 8 years for a transplant in the DC area. So that's why it's really important to look for a living donor. So these calls might not come for several years, so you have to remember that. Sarah, any last questions?
Yeah, we have one last question from Taylor, and he wants to know if I had a transplant with a deceased donor kidney that has KDPI greater than 85%, what does that mean in terms of the duration or effectiveness of the treatment, and what are my options if it fails?
Okay, so so KDPI means kidney donor profile index, but it's an equation, right? So the equation is very dependent on the numbers you put in it, and it's a good way to look at kidneys, but there are some caveats to it. Basically, to break it down, even if you had a kidney with a KDPI of 85%, it still has a 50% chance of making it out 8 years. So if you told me you got a 50% chance of staying off dialysis for 8 years, I would take it. So so understand that that's not a bad kidney because the number's high. The higher that number, the more issues with the potential donor that you had, right? But anyway, 85%, that score is correlated with kidneys lasting, about half of those kidneys will still last 7 or 8 years, which is great. Even the best kidneys, living donor kidneys, don't last forever. They last roughly 10 to 15 years. If the kidney fails, well, then when the whole point of seeing the nephrologist also, our team and your team, your own nephrologist, is to say you will get re-referred for a new kidney when your kidney function gets back down to 20%. So you can have more than one, you can have more than two. I've seen up to 5 kidney transplants in one person. So you would get re-referred for a new kidney transplant. If the kidney never works for some reason, then you would get your time back and go right back to where you were on the list. But that's very rare. If you've had your kidney for several years, then again, kidney function gets 20%. We start talking to you about living donor and getting listed.
Got it. Well, and speaking of living donor, that was what we discussed last time. So if you are interested in learning more about that, I can link the live
throw a link up.
Also. Yeah. Little plug for our last Facebook Live.
What great timing.
Exactly.
Super. So we got all the questions, it sounds like, huh?
Yep. Yeah, there was a lot of them, and we covered most of them. So thank you everybody for your questions and tuning in today.
Yeah, gosh, that was great. We got a tremendous amount and some really, really good ones.
Yeah.
On the questions, if you direct message us, I think we can try to get you back to you by email.
Yeah. If there's any questions that we didn't get to, I will send them to you, Dr. Thomas, and Alex and Jennifer, and we'll respond back in the comments.
And if you have any comments about what you'd like to hear in future Facebook Lives, please let us know. We would love to know what the audience wants. We want to please make you guys happy.
Yeah, leave your feedback.
Yep, exactly.
Yeah. And also, I think we should encourage people to like this event and share it. We want to extend its reach to others that might find it helpful. So please help us spread the word and help other people learn.
Yeah, even not in DC, because it's really relevant for anybody.
Exactly.
Absolutely. All right. Well, thanks to all of you for helping us to learn more about living well with kidney disease. It was wonderful talking to you all. And thanks to all of the viewers who are with us tonight. We will see you next time.
Bye. Thank you.